And within the first week, I started feeling lighter. I didn't feel this constant fog anymore. Hi, my name is Cynthia, and I have bipolar disorder type 1. I also have ADHD, and I am also on the spectrum. I have ASD level 1 and post-traumatic stress disorder. And I recently found out that I am on the spectrum this year, but most of my diagnoses I did not find out until later in life, but I've lived with them since I was a child. And I came across metabolic therapies when I actually was on YouTube. And I don't know, the algorithm that day decided to lead me to Dr. Chris Palmer's. It was a presentation that he was doing at a conference. I don't remember where. And everything that he said, I had been thinking in the back of my head. And I was like, oh, wow, finally someone is actually saying this. And then that's when I started doing a lot of research. I found a dietitian, the only dietitian that my insurance accepted. I was very fortunate enough that this dietitian had actually been using metabolic therapies for 20 plus years. So yes, I got very lucky with getting a dietitian who already understood, everything about these therapies. But yeah, that's how I found out about metabolic therapies, and I have been implementing it in my life since April of last year, and I do not regret it at all. From the age of 5, I knew that I was different. I did not understand what the feeling was, and I always felt disconnected from other people. I noticed that I liked being by myself a lot of the time, and I would get very overwhelmed. From the moment I woke up, I was already overwhelmed, and I did not know how to communicate with others. It's almost like my body was shut down all the time. And, later on, as I got older, I'm like, oh, I had been experiencing depression since the age of 5 years old. And for me, I just remember that it was always anxiety. I always felt on edge. I never felt calm. I was always, worried or scared that something bad was going to happen. I also did experience, I had traumatic experiences at an early age, and it started from 5. So I'm sure that played a huge role for a lot of my symptoms. But they gradually manifested. By the time that I was 9 years old, I remember I was getting off a school bus, and I remember that there was a particular vehicle that I saw, and that there were people in it that they were trying to kidnap me. And I got very scared, but no one else saw it, only I did. So I remember the neighbors took me to the house. They told my mom, they're like, we're not sure what she's talking about, but she seems very on edge. And we didn't think much of it. I'm Mexican and my parents are immigrants, so they didn't know anything about mental health. So I just continued living like that, but my symptoms slowly started appearing. By the time I was 12 years old, I had an eating disorder. I had anorexia nervosa, and I actually was not able to get treatment for it because my parents did not have the funds to send me to a treatment facility. But from that experience, from that moment on, I already experienced what it was like to be in a mental hospital. And it wasn't the last time. From 12, then 14, then 16 years old, then all the way up to 21 years old, I was in hospitals, and they were all for suicidal ideation, depression, eating disorder issues. It wasn't until 2023 I had my full diagnosis, and I didn't have just one psychologist. I had someone else, double check it. And everything changed from there because I had a better care team. And then I finally started taking medication, but I was very scared to take medication again. I was petrified because I had known the experience I had with medication before, and I was worried that something would start working for me and then it would stop, because that was always the case. If I started an antidepressant, I'd have like a good 6 months, and then afterwards it'd go to the other spectrum. I'd start, either getting really depressed or really manic. So we started the medication. And that was actually the first time that I was properly on the proper medication versus all these other medications. But the medication doses just kept going up. And then I told myself, oh, I know this dance. This is going to continue. It's going to continue going up and it's not going to change. And I didn't want to be on the max dose and then that's it. Like, what do I do from there? And like I said, I was the one day, this was in 2024, that I came across Dr. Chris Palmer's a YouTube video, and I was like, I need to do this. Tomorrow I'm going to be 33, and I just remember I was like, you can no longer deny what you have. All you can do is fix it. And I was like, I really want to try everything that I can to fix it. And it was very new at the time, and I was so excited because I'm like, I was like, what if this really changes everything for me? If the medical system has failed me this whole time since I was 12 years old, so let's give this a try. From there, my dietitian, she taught me a lot about not only nutrition, but it's not just nutrition. It's like, what's in your home? Is there mold in your home? What kind of cleaning products do you use? What kind of toothpaste are you using? How much sleep are you getting? Are you stimulating your vagus nerve? Are you going outside? All of that was information that she gave me. And within the first week, I started feeling lighter. I didn't feel this constant fog anymore. I felt very energized, almost a little too energized. I was worried that I was going to the other direction. And at the time, my doctor, I told her, I'm like, look, I'm going to try this, metabolic therapy or ketogenic diet. And she was like, okay. She's like, that's great. I support it. She's like, just keep me updated on how you feel, because I've had patients who use a ketogenic diet and it actually can trigger a manic episode. So and that actually was my case. But we calmed it down. And then after that, it was very short-lived, which was not the case. Summertime for me is the worst time. But immediately it just disappeared. I didn't even experience, it was like almost like a hypomanic episode, we'll put it this way. And yeah, then from there I started learning as much as I could about the diet. I did my own research. I used my school's research, the access to like a research links that they have. And I started reading everything I could. I came across Dr. Ian Campbell's case studies online and just all of this information. And I was like, the answer is here. Why does no one else see it? is how I felt. But so that was another important part in my process, was learning, not just watching a YouTube video or an influencer. I made sure that I really did my research. My life has been filled with a lot of trauma. And I'm very fortunate that I was very young when I experienced, the trauma that I had. And, it wasn't until later in adulthood that I, understood, oh, this is what that was. But I'm a survivor, and I have coped with all of that. That was actually the first thing I did when I got a medical team. Was I was like, all right, it's time to tackle this part here. This is the big one. And it's really nice to be able to talk to someone who has also lived, with a debilitating mental health disorder, because it is debilitating. And I'm so proud of myself for being here, because I didn't think I would make it past 30 years old. In the back of my head, I always knew, I was like, by the time I'm 30, if I still feel the same way that I feel, I'm just going to end it, because I cannot continue like this. And I'm very fortunate that that wasn't the case. So I remember when I found out about the diet, I said, if I find success on this, I want to make sure that others know about it and that they can live a good life, that they deserve to live a good life as well, and that it is possible. I feel like I have been given a second chance at life. I almost feel like a cat with 9 lives because I keep coming back, and I'm very resilient. am very stubborn as well. So I feel like that has worked in my favor a lot as well. But I do feel like I have been given a second chance at life, and that for the first time in my life, I can actually experience life as it should be. That I have the mental capacity to now understand, that I can focus, that I can have conversations with people, and that I actually want to be in the world. I don't take that for granted. That's something that's a gift to me every single day. I would say that I still manage, but I'm getting to the point, like, I can't officially say remission because my doctor hasn't really said remission yet. But I know for the past since I started the diet, which was in April, by the time it was December of 2024, I did not experience any intrusive thoughts. My mood was stable the whole time. And I did experience some anxiety, but this was during when I was in school, like really high stress for me. But that was any little symptom I experienced was very short lived. I would experience it for a day and then it would die down. And it hasn't been until this year that I was actually sitting at my desk one day and I was like, I haven't had an intrusive thought at all. Like nothing. I was like, it was weird. It was this moment where I was like, I have not experienced anything, like anything at all in a very long time. So I'm like, it works. It's been working. It's just you start getting so used to feeling good that you forget about feeling bad. And that's when I had this moment where I was like, wow, I was like, we are not feeling anything. So that has been really, really nice. And like I said, my functioning is so much better than it was before. I have energy. I don't struggle to brush my teeth or to put makeup on or to put my clothes on. I actually have the energy to do all of those basic things. And then even more, I am now even creative. I am excelling in school because I have the focus now to, learn things and be in school. And there's been a lot of positives for me. My mood regulation is really good. Stimming has gone down significantly as well. And I didn't know that. I didn't know that I had autism. So even when all the other bipolar disorder symptoms went down, there were little things that lingered. And I was like, this doesn't make sense. So it's once I got the diagnosis, I was like, oh, now everything makes sense. But because of the diet, I was able to get to that diagnosis. And, I had been living with all of those symptoms of autism and I did not know it, but those symptoms reduced significantly. And, I had periods where I was pacing back and forth or a lot of repetitive behaviors. I was very rigid in, how I would go about even just starting my morning. It almost looks like OCD, but it's not. And all of those behaviors have gone down significantly. And I even forgot to mention about ADHD as well. My executive functioning was terrible. I mean, really, 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 really bad, severe. And I am now able to transition so much better versus before. I mean, before, like I could start something, but I couldn't move on to the next thing. My brain and body just didn't connect to do the other tasks that I had to do. And it would take me all day just to do one task. So now it's really nice that, I can do everything, I guess, normal or the normal way that, people do things. The major setback, I would say, for me in my experience, is I am allergic to a lot of foods. So if you are an individual who is allergic or sensitive to a lot of foods, and they have to, go straight to like a carnivore diet or like a lion diet, that can be a very hard transition for an individual, especially if they've been used to eating a very high carb diet or processed foods. I would say that they just need to be very patient transitioning. And also the price for like better quality food can be a factor as well. If someone asked me why they should try a ketogenic diet when they could just take a medication, And my response to that is, yes, medications can work for individuals up to a certain point. That it's only up, you only have a certain amount of time where this medication will be effective before your body becomes tolerant to it, and then it no longer works anymore. If you're someone who is like, I'm exhausted of medication, my medications make me feel worse, I'm like, let's keep the medication, let's add the diet, and then see if we can start getting off medication. I feel like that's the mindset that the individual has to have using a diet.
Thank you for watching. If you want to see more, check out these recommended videos. Also, if you haven't already, don't forget to subscribe to our channel to stay up to date with our content and help us expand the movement. And if you want to sign up for our newsletter, access our resources, read the latest research, or check out the Think Smart framework, click here to visit our website. See you on the next video.